Moving on, we're going to look at thumb forceps or tissue forceps, and these are instruments that we use to hold on to tissues and manipulate them during surgery. There are two basic grips that we'll use for these. So we'll start with this, which is called the pencil grip. So you imagine it's a little bit like if I were holding a pen or a pencil for writing. This is the standard grip that we use these forceps for in general, and this enables us to pick tissues up from the surgical field and to manipulate them easily, and it gives us lots of fine control. So I can pick the tissues up, I can move them through a range of different directions without having to move my hand. So that gives us lots of versatility to manipulate tissues so that when I'm suturing or something of that nature, I can hold the tissues and place my needle where I want them. The alternative grip is called the palm grip, where you simply pick up the forceps like this, and we use this to pick things up. Now, we should really never use this grip. It's got very little to recommend it. It's extremely clunky and awkward. You don't have any fine control of the tips, and you're going to get very tired trying to hold tissues like that, and you're going to end up applying too much pressure across the tips and cause a crush injury. So we'll generally use the pencil grip during surgery to hold and manipulate tissues. And the reason these are called thumb forceps is you hold them between your first couple of fingers and your thumb is used to open and close the forceps, which are sprung loaded here. Hence you get the thumb forceps name. So these are the sorts of forceps that you're going to see in our standard surgical packs, and we'll run through each of these in turn. So we'll start with this one. So this is a plain or dressing forceps. So for forceps, the critical portion of them is really the tip. So plain or dressing forceps have a very smooth end or tip. They may have fine ridges, as we've got on this version here, but they don't have any teeth which will cut into or puncture tissues. And these are good for holding hollow organs such as intestine or bowel, and many people use them as a general soft tissue forceps as they don't cause puncture injury to tissues. However, in order to grasp tissues, you actually need to apply quite a lot of pressure and quite a lot of force across the tips. So they do cause more crushing injury than the other forceps we'll look at. So you'll see these a lot in general practice. There's nothing wrong with using them. They're certainly a very good choice if you're doing something like intestinal or bladder surgery. But other forceps hold tissues more gently without puncturing tissues because they cause less crush injury, and that's generally what we use in the clinic. But this is a very useful, very cheap forceps that you'll see a lot in general practice. So in contrast, the other one that you'll come across frequently in general practice, and we use a lot, is the rat tooth thumb forceps. So unlike the dressing forceps, which has these plain tips, the rat tooth thumb forceps has 3 interdigitating teeth at the end, and these penetrate and grasp tissue. So if you use this to hold something like a loop of intestine, you'll puncture a hole in the intestine and lead to leakage. But if you use this to hold tissues such as fascia or fat or skin during surgery, then you'll get a nice secure grip. Now, one of the advantages of these over the dressing forceps is that because they have these teeth, they engage and bite into tissues a little bit, and that means to hold tissues firmly, you don't need to apply as much force across the tips, and that's why they cause less crush injury. So the next set of forceps, which we use a lot, which you will see occasionally in spinal practice, are these. Now these also have teeth at the end, so often people confuse these with rat tooth thumb forceps. But if you look carefully at these ends here, you'll see that we've got 2 rows of teeth on each jaw, which run parallel. And when we close those, they interdigitate. So these are Adson Brown thumb forceps. And Adson Brown thumb forceps are really good for handling skin. So we use them for handling skin. It's a little bit like what we've been discussing so far. The teeth on these forceps are so fine that they tend to cause minimum puncture injury to tissues, but they give you a very good and a delicate touch on skin because you don't need to apply a lot of pressure across the tips to hold skin firmly. Because of the multiple teeth they have, a relatively gentle pressure allows you to hold and manipulate skin securely, and that reduces crushing injury. So these aren't suitable for hollow organ surgery in exactly the same way that the rat tooth thumb forceps are not suitable for hollow organ surgery, but these are ideal and really designed for handling skin. And if you compare the amount of bruising you get on skin if you use Addison Brown thumb forceps to hold skin and the plain dressing forceps to hold skin, you'll see that you get an awful lot less bruising along the skin edge if you do use these forceps here, the Addison Browns. So the final thumb forceps that we're going to look at is this one, and this is the DeBakey tissue forceps. Now this is a relatively specialist thumb forceps. A lot of small animal practices do use them, and we use these extensively within the small animal clinic. These are the real workhorse of our soft tissue surgery service. So these combine features of the toothed forceps that we've seen and the plain forceps that we've seen today. So these have 3 very fine ridges running along their jaws. And if you look very closely at the ridges, you'll see they've got a multitude of small indentations are running along each ridge. Now, the ridges, we've got 2 on the top jaw here, 1 in the bottom jaw, and the bottom jaw ridge sort of fits between the top jaw ridge. So what this does is it gives you a little bit of friction along the surface of the jaw here, but it causes absolutely no puncture or penetrating injury. So that, because we've got a little bit more friction there, it means that we can get a very secure grip on light soft tissue structures such as fat, subcutaneous tissue, and on hollow organs such as intestine and bladder. And in fact, we can even manipulate and hold blood vessels with this pair of forceps without causing injury or puncture to the walls. So we get a very light grip, we get a very good, secure grip on those lighter tissues without causing puncture injury and without causing crush injury to the tissues. So these are the most delicate forceps that we have, and these enable us to handle soft tissues in a routine manner with causing minimum injury. And the more crush, bruising, trauma we cause to tissues, the more inflammation we'll have in tissues, the higher the incidence of wound healing complications and infection will become. So we use these a lot to try and minimize those issues that we might encounter during surgery. Now, if we're going to examine you on this, we will try and use a pair of forceps like this, a pair of DeBakey forceps in which the tips are very clear. But on the clinics, we use this variation, and this causes quite a lot of understandable confusion for students when they come into final year and they're trying to pick up a pair of DeBakey tissue forceps. Now, I will show you these because these are a lovely pair of forceps and they're very well designed for their purpose. So these are what we would call a needle pull forceps, because if you look here, what we have that same conformation of tip here that we saw in the previous DeBakey. This is only 3 or 4 millimeters long here. So we have 1 ridge on this jaw, 2 ridges on this jaw, with those very fine indentations running along the ridge. And that means just at the very tip of these forceps, which is where we hold tissues, we have that DeBakey conformation of tip, which enables us to handle tissues without causing crush injury, but firmly. But if you look behind that very tip of the jaw, you can see we've got this cross-hatched foot plate, which is identical to the foot plate that we've seen on the Mayo Hager needle holders. And what this enables us to do is to hold tissues with the very tip of the forceps, but then to come back and to hold needles in the caudal part of the jaw here. So we do see this sort of conformation quite a lot, and in fact our Addison Browns have that same conformation with a classic Addison Brown tip here, and then the needle holding aspect here. And what this enables us to do is to use one pair of forceps to both pick up tissues and also to grab the end of our needle and pull them through the tissues without having to go and get another set of instruments. So it's very, very useful when suturing. We don't want to handle needles with a classic DeBakey tissue forceps because the metal of the needle will damage the fine ridges and indentations along the jaw, and that will reduce its efficacy. So that's why we use this needle pull variation. So I just wanted to say something else which you may have noticed as we've been going through this. A lot of our instruments have these little colour tags and colour bands on them, and this is of absolutely no significance to you, but this is quite a common thing that people do. These are just quite secure autoclavable tags that we put on, and basically this colour codes our instruments so we know which packs they come from. So these instruments all come from the same pack because they have the same colour coding, whereas this instrument comes from a different set of instruments because it has a slightly different colour coding.